Hi, good afternoon, everyone. Welcome to our State of the Patient briefing. We're just going to give it a couple minutes to let some people enter the meeting, and we'll get started shortly. All right. We'll ask if you all can please put your lines on mute. Okay. All right, I think we'll go ahead and get started. Hello, everyone, and welcome to the State of the Patient briefing. My name is Melissa Williams, and I am the Associate Director for Policy and Field Advocacy at National Patient Advocate Foundation. Now, before we get started with our presentation this afternoon, just a couple of housekeeping items to keep track of. I know if you've been a part of our webinars, this is not new, but we just ask for you all to please mute your lines and enter any questions you have throughout this presentation right into the chat box. And we certainly invite you all to turn on your cameras if you feel comfortable. There's no mandate here, but we do love to see your faces and reactions. And so if you're comfortable and able, we invite you to turn on your cameras. And then we do have an evaluation at the very end of this webinar. As soon as you close out, it will pop up, and we ask if you guys can please complete it because we always want to do better, and your feedback is incredibly important to us. So before we get started, we'd love to hear and see who all we have here with us this afternoon. So if you guys don't mind entering into the chat your name, where you're from, your city and state, and a goal for your advocacy this year. What would you like to accomplish as an advocate in 2022? So if you could please enter that into the chat, we would just love to just see where you guys are all tuning in from and hear exactly what you would like to accomplish. And so some of the topics we'll cover today are the insights that we're working on here at Patient Advocate Foundation, specifically at the Patient Insight Institute. We're also going to go over a bit of a policy update, an update related to some of the COVID policies, as well as new patient protections and opportunities to advance our needs navigation work. And we're also going to talk about the advocacy opportunities that you all can be a part of. And I'm thrilled to be joined today from members of leadership at both the National Patient Advocate Foundation and Patient Advocate Foundation to discuss these initiatives and how you all can be a part of it. And so I saw Sarita had said that she liked the tagline, State of the Patient, and we do too. That was actually something that was suggested by one of our former teammates, Sheila Stickle, and we love that we can carry it over here today. And so much like they do with the State of the Union address, we wanted to ask, what is the state of the patient? And you may remember, I think it was just last month in our January Grassroots newsletter, we had asked in a short survey, we had a bit of just a check-in, like just to see how you all are doing. And some of the words that came up when we asked were, people are exhausted, they're being cautious, feeling a little defeated, and we get that. We feel a little bit of that as well. And it's because we've been facing such incredible challenges, right? Patients have been facing the COVID-19 pandemic. We're going into the third year of the pandemic. We have rising healthcare costs, and we're combating racism and mistrust in healthcare. And all of this has just really surfaced in a way that has just made us all feel defeated, exhausted, and still feeling really cautious. We're not exactly sure you know, what the status of this pandemic is. There's still a lot of confusion, right? But what I also found interesting when we asked, you know, how people are feeling, there were some other words that came up too. And people are feeling optimistic, they're feeling hopeful, and also creative. I really like that. And again, over at National Patient Advocate Foundation, the team here, we feel all of those things. And I think that's what makes this, our volunteer network, just so, so unique, and also really such an asset for us, because you guys are, you know, you're exhausted and optimistic. You guys are, you're channeling that energy into something that we really are grateful for. And, you know, we've been thinking about this, and, you know, we're just like, all of these different things that are happening right now just makes it feel as though that we're at an inflection point here with healthcare. You know, again, there's still a lot of uncertainty around the pandemic. There's a lot of people who we've been greatly impacted by it, right? And there's still some questions that are, you know, that a lot of us have. And I think NPAF and PAF specifically, we're really well positioned to direct the narrative of what comes next. And we're going to talk a bit about what that means exactly. And I just want to share here information from Patient Advocate Foundation's annual impact report. And this is really what I mean by, you know, we are well positioned to address, you know, what comes next, or even direct that narrative. We have the wonderful folks at Patient Advocate Foundation who have been providing direct needs navigation support to patients throughout the country. And I want to highlight that because when I speak with new volunteers, when they sign up, they talk about how, you know, if they're a patient themselves, they talk about their personal situation, or if they're a caregiver, they talk about, you know, I've had to do this for my loved one. I had to make calls to get a prior authorization approved. And if I wasn't there for my loved one, I don't know what would have happened. And you all sign up to volunteer because you think about, what about everyone else who doesn't have that? And I think that's so powerful. And I share that to show, or to connect the dots to the work that Patient Advocate Foundation does, because our case managers at Patient Advocate Foundation do this sort of needs navigation support day in and day out. And they've been doing it for 25 years. And they've learned a lot in those 25 years about how to address people's needs, how to meet people where they are. And I know the slide's a bit busy, but I wanted to just point out two parts of the slide specifically. And this is the top ways PAF case managers have helped patients. You'll see here, it's helping with food assistance, negotiating financial discounts on copays, obtained utility financial relief, secured ground transportation, located mortgage payment relief, educated on disability eligibility and enrollment, educated on health insurance eligibility and enrollment. And that's all really important. And we call that needs navigation. And the thing is, when you also look at that slide, and I picked this apart too, when you see how people learn about Patient Advocate Foundation, it's through these different channels. Either they were referred by a family or friend, a government agency or representative. Most people find Patient Advocate Foundation because they're referred by another nonprofit organization. And then you see here, there are some other ways people learn about Patient Advocate Foundation. But that lies the problem, right? Having people learn about PAF through these channels alone is not enough to reach everyone. And so what we are planning to do, and what a lot of what this presentation today is about, is these different initiatives to address this problem. And our plan really is to help meet people where they are. And the way we're doing that are really through two initiatives. The first is targeted outreach to disseminate Patient Advocate Foundation services. And you may have seen an announcement earlier this month from our CEO, Alan Balch, where he discussed our Patient Advocate Foundation's health equity programs. And mainly what we'll be doing in doing this specific outreach to communities is really identifying those areas of high need and partnering with communities to scale these services. And you'll learn soon about how you all can help be a part of that. But what we're also doing, in addition to this targeted outreach, which is really important, what we're also doing is embedding needs navigation as a part of healthcare. And what we mean by that is we're working to raise awareness about needs navigation services. So the services that PAF provides, right? We are raising awareness about that. And we want to advance policy proposals that standardize those services so everyone can have access to that. And for us, this is how we will advance health equity. And there's certainly a role for you all to be a part of that. And here, I'm drawing from my public health background, so this is something that I put together, but we want to make an impact, right? And I think one of the things that we have to remind ourselves is that this is a process. And so part of a lot of program development in public health, and most programs, period, involve these 4 steps. You do your needs assessment to identify the gaps. You develop the programs or the intervention. You implement it, you monitor and evaluate, and you do it again based on the lessons you've learned, and you keep doing it until you reach your goal. And it's just a continual process. And I wanted to just underscore here that we are working on each of these steps, but along the way, we're involving patients, caregivers, patient advocates throughout. And so I'm delighted today to have, again, my team here or the NPAF and PAF team here, some of our leadership, to share exactly how we're going to stay true to this. So I'm going to introduce my teammate here, Rebecca Angove, who's our Vice President of Patient Experience and Program Evaluation at Patient Advocate Foundation, and also the Director of the Patient Insight Institute. And she will talk to you exactly about how we will involve you all in this process. So Rebecca, I'll turn it over to you now.
Hey, thanks, Melissa. So I am just going to share my screen and a few slides. Tell you a little bit about the Patient Insight Institute. And if you want to learn more, you can reach us on the website. So reach out, read through the website and dig a little deeper. For those of you that have already heard about or learned about the Patient Insight Institute, some of this may be old hat, but it's always good to hear it again. So the Patient Insight Institute was developed out of really the 25 years of work that PAF has been doing to make sure that patients with access and affordability challenges get the services they need and make sure their needs are met. We really wanted our focus of this institute to be the entire patient experience. And instead of just serving patients, we want to take what we learn at PAF about the patient experience and really make sure that healthcare policy and services are informed by those experiences and specifically the ones, the patient experiences and caregiver experiences who have historically not been listened to or underrepresented. So those that are facing access and affordability challenges often haven't been a group of patients that have been engaged in a lot of these initiatives. And we really want to partner with people that see the patient perspective as critical to these changes, either in the policy space, the research space, and in the advocacy space. So that's really what drove us to build this institute. It's really a hub where we can do this great work. We have partnerships and collaborators that are researchers, healthcare systems, policy leaders, and of course, our great patients and caregivers all working together to really make sure that patient centricity and the patient perspective is not just an afterthought, but really drives decision-making, policy, and informs all of the research that's being done. So this slide is just a little bit about how we're doing that, right? So we are generating evidence. We have so much rich information that is shared with us through the direct services that we provide, as well as other survey initiatives, focus groups, and listening sessions. And so the work of the Institute is really to continue to pull in some of that evidence that is needed to get these policy and healthcare transformation initiatives to really stick. We are also working to build capacity of others to integrate the patient perspective. I'm sure many of you have had experiences where somebody that you've worked with, a researcher, a policymaker, a healthcare provider, just don't know how to engage patients, how to listen, how to integrate your experience or your perspective into their project. And so we're really going to help our partners do this and do this well. So the patient involvement isn't tokenistic. It's not just a checkbox, but it's something that is very meaningful and, baked into the work that is being done, not only by the Institute, but our partners. And then we're continuing to expand our engagement. We have a network of about 4,000 people that we call our Patient Insight Network. And we're continuing to expand that number and find opportunities where we can connect our network members to people, places, events where they can really bring their story, bring their voice, bring their perspective, and make some changes, and really ensuring an equitable and diverse perspective is represented. So that's kind of at the center of everything we do. Again, making sure the right people are bringing their perspectives to all these projects. And then, we have a number of priority areas, and it's really about building partnerships, pushing that culture of research, policy making, healthcare transformation to be not only patient centric, but patient driven, right? It's not just about building everything around the patient, but making sure that patients are informing the strategy, the development, and the decision making on the front end, as well as all through the entire process. And we're trying to find proposals, partnerships, and funders that feel the same way, that can really engage with us and push that boulder up the hill, which that sounds harder than it is. I feel like we're making strides changing this culture. We have a number of people that we're already working with, and this list just continues to grow, both from a funding side, people that believe in the work that we're doing and are helping us build this infrastructure, as well as collaborators that really want to integrate the patient perspective into their projects and have, signed on to do projects with us and collaborate. We have a number of PAF and NPAF members that are really both internal advisors, and then the directorate is Nicole, Kate, and Rebecca. I'm sure you've seen our faces on these calls. And a few ways that we hope to engage this group of volunteers and advocates is really to pull you in to not only some of these survey and research projects, but also to include you as we're reaching out when projects need advisors, when they need committee members. We're going to be reaching out to ask if you can help us inform, our own internal strategy. And so we're really going to be integrating this group in a number of ways around a number of topics. Right now, one of the things that is top of mind that we're working really hard on is our COVID-19 learning community. That is a group of patients, caregivers, researchers, and providers that have come together and are working on creating research prioritization and embedding patients in some of these really interesting projects around the impact of the pandemic, specifically on not just those that have been diagnosed, but people that have been impacted just living through the last 2 years. So that's another project that you might hear about or see on our website. So I only had a few minutes and I ran through the slides pretty quick, but I would invite anybody, any of my colleagues, if there's any questions you have, or any of the volunteers, if there's questions, either chime into the chat, jump in right now, or reach out, and I'm happy to engage via email, text, or phone, and answer any questions that anybody might have.
Great, thank you so much, Rebecca. And now it's my pleasure to introduce Becky Shipp, who will provide a policy update. And Becky, I see you're ready. We'll go ahead and turn it over to you. Thank you.
Yes, thank you, everybody. Welcome. Good evening. I'm going to talk about some of the opportunities to influence policy, but also give you a little snapshot of the current state of affairs on the Hill. It's an election year, and that means 1/3 of the Senate is up for re-election, and all members of the House who are running again are up for re-election. Traditional, and it is the midterm of a new administration, which generally creates some challenges for the majority party. There is some thought that the majority will switch, at least in the Senate, or at least in the House, excuse me, and possibly in the Senate. So while that may make for a challenging congressional environment, it's not without its bright spots. And one of those bright spots is the work that's being done, led by the Senate Finance Committee, Chairman Wyden and Ranking Member Crapo, to address mental and behavioral health issues. Last year, the Chairman and Ranking Member identified their interest in moving forward. They put out a request for information around these 5 domains. The domains are strengthening the workforce, increasing integration, coordination, and access to care, ensuring parity between behavioral and physical health, furthering the use of telehealth, and improving access to behavioral health for children and youth. We've been, as your DC advocates, we've been watching and monitoring this situation. We've been interacting with you all based on your input and anticipating the committee's work. We have not adjusted our principles because behavioral health was always a key aspect of those principles, but noting that issues associated with behavioral health are a critical feature of needs navigation services. So we appreciate that, and we're pleased to anticipate, which may be, at least a very interesting discussion over the next few months. The Senate Finance Committee has held 2 hearings so far, one recently this week, actually, which stressed telehealth, coordination among systems, social determinants of health, and culturally appropriate care. All of these issues are issues that the Institute and NPAF have been working on for many years. And so we're excited about the opportunity to engage on this endeavor. I would note that this issue, the emphasis on mental and behavioral health, is not isolated in the Senate Finance Committee. The Senate Health, Education, Labor, and Pensions Committee, the Health Committee has held a hearing. On the House side, the Committee on Ways and Means and the Energy and Commerce Committees have identified that they are having hearings on this. So this is something that members are taking seriously. And so while it is an election year, it does create an opportunity to advance some of the issues that people have been working on, particularly around telehealth, social determinants of health, equity, and the ongoing need for needs navigation. Other items on the agenda, there have been a number of provisions that were enacted in various COVID protection bills that have either expired or are scheduled to expire. Most notably scheduled to expire is the requirement under Medicaid for continuous eligibility. As you know, many states have to, at various increments, determine eligibility for public programs. That's expensive. People fall through the cracks. It oftentimes, reflects an interruption of services. So we will be monitoring that. The Biden administration has indicated their desire for an additional COVID relief package that is to be determined. Also, we're monitoring the effects of the No Surprises Act that was effective January 1st of this year. As many of you know, that requires private insurance to cover out-of-network bills. It prevents charges greater than what would be that would be covered if services were in-house. It requires insurance companies to notify patients of their rights in terms of providing coverage. A lot is unknown about how No Surprises will be implemented. There's a lot of uncertainty around what providers have to notice patients for in terms of their protections, how patients, address consent forms. There have been a number of lawsuits by AMA and AHA on certain requirements from the from the administration. A lot of this will be litigated, through the courts. As some of you who have tuned in to past webinars have noticed, we are also examining options in current programs and policies to advance the needs navigation agenda. Some of these include the targeted case management program, the thank you, Ackerman check, yes. Problem with the DC. Thank you for noting that in the notes. And other programs such as the Medicaid CHIP and poverty programs offer opportunities to advance the needs navigation agenda that we'll be tracking, in addition to tracking, again, the mental health and behavioral health agenda to advance the need for needs navigations. I went through that really super quickly. Happy to answer any questions, or if you want to put stuff in the chat or contact me directly, happy to respond.
Thank you, Becky. And I think I see Brittany raised her hand. So Brittany, go ahead and ask your question. I think we have some time.
Can you guys hear me all right? I'm driving home and I'm so sorry. My Wi-Fi kind of cuts out a little bit, but can you guys? Okay, great. I did have a question for, I believe it was Becky that just spoke, and I'm sorry if I did not get your name right. But do you foresee any issues with this Supreme Court justice that is now stepping down, and then the president appointing a new Supreme Court justice? Do you see any potential filibustering going on in the Senate? Are you optimistic that these bills will continue to move forward? Do you feel like it's something that's bipartisan, that has bipartisan support?
Thank you for that question. It's an excellent one. So because there have been changes in the filibuster rule relative to Supreme Court nominees do not require a 60 vote threshold to pass. They just need 50 votes. I understand, from what I've read, that they would like to get some Republican support, but they can install a new nominee for Justice Breyer's seat with all the Democrats and Vice President Kamala Harris in the chair. So it's not anticipated, because that is not the seat isn't flipping. It was a liberal justice, and it will be probably someone appointed will be considered liberal. There's not the kind of battle that would rage if it was going to change the breakdown of ideology along the court. So I'm not anticipating that there will be a fight over that. There does seem to be reluctance to change the filibuster rules. I think, Senator Manchin and Sinema have, indicated an unwillingness to make the types of changes, for example, that would, allow passage of things like, the voter access legislation and others. So I don't know if, for example, there was enough consensus around a mental health agenda, if that certainly would be probably subject to the filibuster, assuming that it was not included in a reconciliation package. This is getting way deep into the weeds, so I'll just kind of pull up a little and say, we don't really know what the outcome is, but I don't think the Supreme Court issue will be much of a drag on the legislative agenda.
Awesome. Thank you so much. That was a great response. Thank you.
Mm-hmm.
All right, I know, Faye, you have your hand up, but we have just a couple more presentations to get through. So hopefully we can get to your question after Mary, who's going to touch on some of the advocacy opportunities that we have for you all for this year. So I hope that's okay, Faye. And you're certainly welcome to enter the question into the chat. But Becky, I just wanted to thank you for sharing that update. That was really great. Also, I know Rebecca had noted this in the chat too, but the mention of behavioral health is something that even our own volunteers through our advisory group had noted as something that we need to be considering. And so just wanted to make that note here that we're even hearing that that feedback from our volunteers. And also a note on the No Surprises Act. You're right, Becky, that there's still a lot of unknowns as far as how this is going to be or what the impact will be, but we know that there is a new form for patients to complete that can be a little confusing. So we are working on a new resource, both from Patient Advocate Foundation and National Patient Advocate Foundation, that we hope to make available to you all soon, that explains this new law and what you all need to be considering as you see your doctors or go in for procedures. So at this time, I will pause with what I'm saying and turn it over to my teammate, Mary, who will talk about some of the advocacy opportunities that you all can be a part of this year.
Thank you so much, Melissa and team, for sharing such incredible insights into what we have upcoming with both organizations, with NPAF and PAF. I'm going to go ahead and quickly share my screen. I want to make sure we're able to get to everyone's questions. So I'm going to ask if everyone can see my screen. Perfect. So, I firstly want to begin by really looking at sort of what's been communicated so far in this webinar. We have an exceptionally unique opportunity here to bring grassroots advocacy to the healthcare space, especially as it relates to patient and caregivers and what their focuses are on. And in order to do this, we have to do it through effective grassroots organizing. So I want to connect some dots between everything that was presented and discuss a little bit more about the different opportunities that are available. So threading the needle here with the 2022 focus, we have what we call the head, the heart, the gut, and our feet with advocacy. So what the head is what Rebecca and Gov had discussed, which is the insights. The insight is what your experiences that you share with us, allowing us to use that to really power and advance the whole of the NPAF and PAF agenda. Nothing can move without the head signaling to the rest of the body to do so. And that is all because of you all. We look at equity. Equity is the heart of everything that we do. It's about access and affordability. It's an incredibly broad and vast umbrella, but there's so much that it touches on. And, when we discuss access and affordability and meeting people where they are, that is really the vessel that powers every movement everywhere. And looking at what I'm going to be discussing, which is advocacy, this is really the gut. This is things that drive you out of fear and out of excitement. And it pushes you to take action. This is where we all come in here. And of course, everything that grounds us is policy and everything, all of the incredible work that PAF has been doing for the last 25 years. The evidence generated from PAF's data collection and research and analysis, all of the policy that has been curated for hundreds of years in this country. This is our landscape, and this is what we stand on. So sometimes we wobble, sometimes we fall down, but there's always something that we have. There's always some type of foundation for us to stand on. And we need you all to really build policies that better speak to patient and caregiver needs. And each of these areas really set the stage for how we're best positioned to build demand for needs navigation and build an informed patient-led movement. And one of the things that we want to discuss is, why are we emphasizing advocacy beyond it being in our name, National Patient Advocate Foundation? To start, there simply is no progress without you. And your experiences really inform us on where the gaps are. We wouldn't know where to navigate without you all disclosing that to us. And your insights absolutely build up each and every one of our organizations and really guide us towards something meaningful and actionable, which we're trying to forward here with the needs navigation and embedding needs navigation within the healthcare system. And of course, your consistent and passionate advocacy is the impact. And that is the movement. And we need each of your leadership to bring attention to a problem that has always existed, but where patients and caregivers really do have a strong hold on what the solution is for advancement, and working with us to make sure that it happens. And, one of the questions we often get from our volunteers is, well, how am I able to communicate this to my community? And one thing that we always say over at NPAF is, out of everyone, you are best positioned to know the needs of your community. There are so many nuances that are going to go over everyone else's heads. How you speak to, your neighbor and your parent, your teacher. These are, how to change your language and really level setting a personal conversation by, first of all, sharing your personal connection to the initiative, whichever is most comfortable. That really does let a layer down of defense that people have once you're able to personalize the issue and really share why you care about it. And of course, always taking a more grassroots approach, having somebody from that area and from that community strengthens the message, and it's far more effective than somebody who represents a larger organization when it's coming from a community member that knows the people, that gets it, that shops at the same corner store, that has shared the same position with their kids for the past 25 years. That is far more meaningful from it coming from you than anyone else. So really quickly, I wanted to highlight what grassroots organizing is. High level, there are three major pillars to it. There's capacity building, there's communication, and there's an accountability element. So what this looks like is when you're building capacity, it's about recruitment. But it's not just about the bodies that you have and the amount of phone calls that you make. It's about very strategic and intentional relationship building. Have these people remember your story, remember your face, and remember even 2 lines of a conversation. That's what they're going to remember. And you want to make sure that you're having direct conversation with people, and that's going to motivate them to take action where they otherwise wouldn't, because you made it personal. And the best way to do this again is through relational tactics in your neighborhood, in your community. I'm more likely to listen to somebody who grew up in my community than someone who's, coming from 3 states over, who doesn't really care about where I live and work, where my parents are living. Communication is an incredibly essential element of grassroots organizing. when you're communicating with someone, you have to be intentional and you have to be consistent. It's not a one and done. This effort is something that is going to take a few years. It's not going to be done next week. It's not going to be done in 2 years. It's something that will always need to be continually updated because the healthcare landscape and people's needs continually change. So when we're having these conversations, again, sharing that personal story invites your audience in. And if you deliver it well, it anchors them into what really is important. You want to make sure that you're consistent and you're providing updates on the progress of this initiative. Bother them, but politely. You want to make sure that people understand, oh, this is actually moving forward. This is, and this is why it's even more important now than it was 6 months ago. And again, you want to keep consistency is key here, and accountability. We always want to make sure that our goals are achievable. While we would love to knock on every single door and make 20,000 personal phone calls, we have to be really strategic and really smart about how we go about it. So again, it's about positioning yourself as a leader in your community, tapping 5 people that you've identified after 6 months of studying your community and looking at, okay, these 5 people have 300, 400 people underneath them, and they really listen and they reply to emails and they show up at town halls. And if I can build a relationship with these 5 people, I have a relationship with 1,000, and I can show up for this 1,000, and I can show them how their engagement is really forwarding and bettering health where I live, because we need it and we've been needing it for a very long time. And also make sure that your goals make sense for your audience, and you share successes as they come, and you share where you're falling short, because that will also encourage them to map out, oh, I don't want my community to fail. I want us to reach our goals. I've seen you show up time and time again for the past several months, and I want this to be successful. And this is how we're going to be able to do it together. And so some of the direct actions that you're going to be able to take, again, position yourself as a leader in your community. That takes time. So attend and participate in town hall meetings. Ask what's on the agenda. When they get comfortable with you, you put an item on the agenda and have it be about needs navigation services and about the health needs that you need in your community. Identify the allies in your community. When you do that, you can educate them on what needs navigation is, the types of services that are available. And of course, NPAF will be curating we currently have resources, and we're going to continue to build on them about how you are able to communicate this to people where you live. And some of the different allies that you can just think of topically that could benefit from needs navigation services. They're community healthcare workers, health clinics, maybe your personal doctor's office, day centers, young people who are going to be getting health insurance for the first time, people who are newly diagnosed. Really look at who could really stand to benefit from having these services available to them at touch. And of course, again, building manageable and consistent relationships with your community and its leaders. Recruit. You want to build a small community cohort, point them to our needs navigation resources and overall NPAF offerings as well. You want to make sure that these individuals that you've identified to echo the importance of this initiative, what are they passionate about? Connect to them through there. Do these leaders currently have a health equity agenda? What does that look like, and how do they plan on advancing it? Does it make sense, and how can you be a part of that conversation? So to quickly sort of round this up, looking at effective organizing, start early, build capacity, be persuasive. You want to mobilize people. The best way to do that is to equip them and empower them with resources and training, just so they feel comfortable communicating what this is, and it's important for years to come. And of course, you always want to engage with people in your community. So know where your community stands on an issue, so you can tailor a message that really resonates with them, and outline specific and simple actions that they're able to take as well. So to start, if you want to start right now, if you have 10 minutes today, 10 minutes tomorrow, we're close to the weekend, make a list. Begin with who you know, who's in your phone, who could currently stand to benefit from needs navigation services. Is it a parent? Is it somebody that you caregive for? Is it you? Or 2 colleagues that you met in passing? Mobilize, sort of structure your story, whether it's about, if your story is simple, as simple as I'm just passionate about my community and everyone was really struggling with COVID, and I know somebody with long COVID, and my goodness, how much more incredible it would have been if it was a little bit more clear as to where to find help, because you're going to end up being that resource for them in your community, and that's what you want. And engage your community leaders. Oh, I do have one more slide. So as many of you know, NPAF has 4 distinct campaigns throughout the year. And we structured this in a way that reflect the arc of the patient and caregiver experience. And we start the year with our Be a Hero campaign, which is coming up in April. And this is where we focus on normalizing care planning conversations, normalizing care planning and conversations around it. And in June, we have our Caregivers Count campaign. This is an awareness campaign that we have where we really want to educate people on identifying themselves as caregivers. Once you're able to do that, you have so many other resources that sort of open up as to different resources that are able to support you in your journey of caregiving. And so many people miss out on that because they may not necessarily identify themselves as a caregiver because they think, oh, I'm just, I'm the mom, of course I'm going to do this, or, I'm their spouse or I'm their kid. But there really are resources out there to help caregivers where they are. We round up NPAF specific campaigns towards the end of the year with our, what has been widely discussed here today, our needs navigation campaign, which again, as it was mentioned at length, we want to embed needs navigation services within our healthcare system. And of course, we end the year by joining the chorus with many other organizations to bring awareness to open enrollment for the Get Covered campaign.
Thank you, Mary. That was wonderful. And we invite you all to enter any questions you all have into the chat. But at this time, I'm going to turn it over to Rebecca Kirch, who's just going to summarize this conversation today. We presented a lot of information. Rebecca's always really great at connecting the dots. So I'm going to turn it over to Rebecca to bring us home.
Hi, everyone, and thank you so much for tuning in today. It was a pleasure for me, and I got to just sit back and listen and think on where we're headed. And the words that we started with, there's cautiousness, but there's optimism. And I think I share those feelings as well. We're so grateful to all of you and also to our sponsors. And I think we have a slide. All of this work is done under our Patient Action League, the campaign work that Mary just touched on, but also how we're building the next generation of community organizing and outreach with all of your help. Your insights don't just guide us in what we do, but also how we do it and the resources we equip you with to make it happen. That's really the genesis for the 4 campaigns that we created, as Mary described, the arc of the human experience with complex chronic conditions. It starts with care planning and caregivers and morphs into the needs that they have outside the medical system that we want to tend to, and is a major emphasis area for Patient Advocate Foundation because of the direct services that we deliver. And it makes only the best sense that we sort of help lead collaborative partnerships and coalition work that we'll be building together with your help to make needs navigation a standard of practice in every care setting, so that we don't just focus on the disease or the diagnosis or disease-directed treatment, but also support everything that else is happening in patient and caregivers worlds in terms of the worries that they have to support their mental health, their financial health, and their physical health. So those were insights that Melissa hit on, came from our advisory group and work that we've done with you. Those are insights that came from our National Patient Advocate Foundation Board of Directors, that it's time to be more explicit about financial health and behavioral health together with physical health. So that's our opportunity now and next that we're very excited to work with all of you in. There's a great deal, an abundance of gratitude for what you've done and the optimism it gives to us. Melissa's featuring here our upcoming Be a Hero, Make a Plan, which critically starts the dialogue about what matters to people and the opportunities we have to use the resources that you helped co-build to make communities be thinking about their opportunities for next steps of action. There's an evaluation we hope you'll complete, and I'll ask, I'm not monitoring the chat to see if there are questions, Melissa, but we do have time for a couple before we close out the hour.
We do have some time, and we invite you all to enter any questions into the chat now, or you can raise your hand and we can call on you if you feel comfortable doing that. Let me see.
We want to make sure we get Faye.
Oh, yeah.
I know she wanted some resources on No Surprises Act, which the timeline is short for us to get those done, especially if Faye's telling us to do it. Now we gotta get her done, if you will. Hi, Faye. But was there something beyond the resources you wanted? Tell us what you had in mind.
No, I sent it directly to Becky Ship, the questions, and she did answer for me. Thank you.
Oh, great. Okay.
Great. Let's see. I'm looking at the chat now. I see a question from Jane. She asks, I think, a really good question. Is there a current listing of who has NPAF on their radar for a resource? And Jane, I'd love if you're available to unmute. If you want to elaborate more, you're certainly welcome to. But I'm thinking my understanding of this question is if NPAF has a list of who we would want to share NPAF resources. Is that right?
Well, thanks, Melissa. This is my first interaction with your group. I just retired as an RN, and I've been acting as a caregiver for an elderly aunt and through a friend who just went through cancer and unfortunately passed. And so listening to Mary's segment about assessing my community needs and everything, I'm feeling very overwhelmed about where to go and where to take this. And, you know, if I did go to a resource in my community, would they even know who I'm talking about?
Got it. And so I think I understand what you're saying. And we do have with each of our campaigns, and we're creating one that is more broad. We're creating tools so that you know exactly who it is that we think you can connect with. So whether it's your local health department or your, the Boys and Girls Club, if that's an influential entity in your community, we are working on that list. So you have not just a checklist of who you can potentially reach out to, but also in addition to that list, we will also have a conversation guide. So you know how to talk about NPAF, PAF without feeling overwhelmed. And so you have a script to follow. Is that what you're looking for?
Yeah, that would make a difference. Thank you.
Yes. Okay, perfect. And thank you so much for being here. I'm so glad you can tune in.
And we're lucky, Melissa, Fran Castello is on the phone. And in terms of Patient Advocate Foundation as a resource, Melissa started this talk with the explanation that we're only available to those who know about us or get referred to us. So Fran, if you want to take a moment to talk about what we really mean by how we want to get into every community, the floor is yours to we're so glad you're here.
Thanks, Rebecca. I was just typing away in the chat to say I was so glad to hear that question because I've been with PAF 22 years. And there's never too much sharing. And it takes all of us to get the word out, so to speak, about what PAF does, because what we do for people and how we support them, you don't need our help till you need our help. And that's why you won't ever see us running ads or, having billboard displays, which we wish we could, but that's just not the kind of organization we are. And we really, really are continuing in 2022 to build on our success of the past and get into as many communities as possible. And what we mean by that is we need people who live in those communities to go to their doctor's office and to their health department and to their beauty shop and to their church, and share information about PAF and what programs we offer and how people can contact us and get help from us, and how important it is to have organizations like ours. And we're not, certainly our whole nonprofit community has value and has great importance, and just the importance of people knowing about our services and understanding how to plug into them, and also sharing why people who have a chronic or critical disease or are caregiving for someone who does need this kind of help, and why that should be kind of a system baked into our systems, which unfortunately it's not today. And I know that's the efforts of my peers at NPAF, and we're here to do all we can to support them in that endeavor. So I hope that kind of grounds everybody. A lot of people know us, and a lot of people don't. And I think that's the short answer. And we want to, continue to take bites of that elephant, so to speak, of people who don't know us, and make sure that they do, and just know that we're here to help them.
Thank you, Fran. And I think what you said that I'll want to reinforce from the way that Patient Advocate Foundation has provided its services over these years has given us so many learnings from the people that are served, but also from the staff who do that service, our case managers that have gone into the crafting of our needs navigation policy agenda. We know that there's a magical formula here that PAF has developed in its services that everybody everywhere needs to have access to. And that's how we've translated those learnings into potential policy solutions that Becky Shipp touched on, and that we will continue to talk about across this year. But you are critical assets, all of you who are volunteers, who are partners, who are collaborators, in helping explain these problems. Because people, they don't just not understand who Patient Advocate Foundation is, they don't understand necessarily, as Fran said it, until you're in it. You may not even be aware this was a problem, let alone that there is a solution that needs to be readily available everywhere. And what we know now is you shouldn't just be lucky to get referred to PAF. You should be expecting that this is part of health system change, that we bake it in. And that's the opportunity that our tools, our dialogue, our partnerships with all of you are really going to focus on coming out of the gate this year. Is how do we help make understanding about people's needs for behavioral, physical, financial health, and needs navigation as an opportunity. Going back to Mary's head, heart, gut, and feet. That's the part that I think all of us can play that leaves me with hope, optimism, and creativity in my head as we close out this call. But colleagues, please join in if there are any other questions we need to cover. And a last plug that I promised Melissa to please fill out the evaluation. We love hearing from you in the chat, in the evaluation after, and throughout the year as you participate with us in these regular calls.
Yes, I think we have Brittany again, who has her hand up. So Brittany, go ahead and ask your question.
Hi, everyone. Thank you so much for this session. It's been awesome. I've really enjoyed it, and I really appreciate all the information that was shared. It's more, I think I have like two questions built into this statement. So I've been following the healthcare budget that's been being discussed in the House and the Senate, because we're currently in session in Florida. And it looks like there's going to be a lot of funding cuts, especially as it relates to Medicaid. There's also a very big controversial abortion bill being passed, and it's going to, if you have an abortion, it's going to prevent any abortions from being had after 15 weeks, unless you have a double consent from 2 different physicians, which a representative brought up a really good point. He even said it on the floor. It's very hard to meet healthcare needs within our state. And it's very hard to be able to even find just one doctor, let alone having to find 2 doctors. I think that kind of fueled my fire in terms of, okay, we're going into an election year, and this is exactly when we need to be talking about healthcare and like what people's healthcare needs are. And that should be what their mindset is, along with many other factors going to the polls in November. But I have some friends that are interested in joining our group, our foundation, as volunteers, and I'm very interested in also getting a copy of Mary's slides, because my service cut out during that portion, and she was mentioning grassroots advocacy, and I definitely want that information. So those were my kind of 2 questions. One, can I get the slides for Mary? And then also, how can I guess, get my friends that are involved and passionate about volunteering involved?
Great questions, Brittany. Yes, I see Mary also responded. Of course, you can get a copy of the slides, and we can share a copy of all the slides that we showed today. And as far as getting people to join our volunteer network, you are awesome, Brittany, for bringing people to our cause. You can direct them to our website. If you just click Get Involved, there is a form right there that they can follow, they can fill out. And if you can just let them know that you referred us, or you referred them to us, we would love to capture that. So thank you. All right, so we're just 2 minutes after the hour. I know we didn't get to all of the questions, but we will comb through the chat and follow up with you guys directly if we didn't answer them. Rebecca, just want to make sure you can give the final close here.
The final close is gratitude again to all of you who tuned in, to this incredible staff that I had the pleasure of sitting back and watching on Patient Advocate Foundation and NPAF side, who contributed to this session today and to what we have ahead. I'm just awed by the passion and the enthusiasm, and we do energize each other. And so we're grateful for that and excited by that. And look forward to what's next.
Great. Thank you, everyone. Have a good evening.
Take care all.
Thank you. Thank you.
Thank you.
Thank you.